Another test they can do to ascertain if it's a meniscal lesion is what we call Apley Compression distraction test. And how do you do your Apley Compression distraction test? If you want to do it effectively, move something on. You may have to climb over it, over the couch. Then you may stabilize the thigh and you distract. So this is distraction. Then for your compression, is a vertical compression. You compress by closing up the knee joint. So if there is problem with the menisci, it will be painful. Then with the complaint of pain. And for you to ascertain it, you do your distraction to open up that space. When you distract and the pain is elevated, then you have confirmed that it's actually a menisci problem. Okay, a menisci problem. You know we have the lateral menisci and the medial menisci. So you need to apply a torsional force. When you compress that one, then you apply a torsional force by rotating internally. With this rotation, you are constricting the medial compartment. So when you rotate internally, that torsion force, if it is painful, then you know it's the medial menisci. If you have a sort of external rotation, you are locking the lateral menisci while you compress. So if it is painful on this side, then you know it's the lateral meniscus that is affected. There is a patellar femoral compression test. This is an isometric test too. You may insert your hand on total region and ask your patient to press down. Press the wrong down. You see an isometric contraction. Then you can now grind the patella against the tibiofibula and the crown of the femur. So if it is painful, then you know there is a problem in the patellar femoral joint. You can also glide superiorly and inferiorly. This you have to be very careful with this. So you need to guide the patella so you don't have a dislocation. So you may glide superiorly and see if it is painful. Then you may glide inferiorly by guiding down and see if it is painful and see if it is painful. If it is painful, then you know there is a problem with the patellofemoral joint. There is another test which we call the Lachman's test. Lachman's test is actually to test the stability of the knee joint, of the patellofemoral and the femoral tibiocondylar joint. So you flex and you apply an upward force and downward force to see if there is a shift in the knee joint while you apply an anterior force. So if there is a shift, then you know there's loss of stability at the knee joint.